like roughly every 3 to 4 months. I was tested about 2 weeks ago. It was like a Monday morning, and it was just like me and this other guy. We were sitting in the waiting room. You get free counseling before you get an HIV test. And it's hard to explain, but you know, like sometimes you just like hate someone's face. Like something about them just does not jive well with you. You just don't like their vibe. So I hated the guy sitting across from me. I found myself growing oddly competitive with him, which there's really no reason to be too competitive with someone who's about to get an HIV test, after all. Like he was reading, you know, I think he was reading like Newsweek, I had The Economist, that kind of thing, that dynamic. But right before the counselor came out, she called him in, and right before he went in, he took off his sweater vest, and I swear to God, he was a gay man wearing a t-shirt that said 2012, Sarah Palin is my president. Fucking come on, dude. I honestly thought to myself, if I have AIDS and that guy doesn't, I'm gonna be so fucking annoyed. It's gonna be like the worst day of my life. I even think most Republicans would agree with that even. He was in there for about 20 minutes, and then he came out. I went in after him. A couple things annoyed me about the counselor. First of all, she refused to give me his results. I explained our dynamic. I'm like, I know you saw his shirt, and I know you didn't appreciate that. The other was, like, I always assume, you know, before you get counseling, I thought it was just going to be, you know, before you get the test, I thought the counseling was going to be like stroking my ego. I thought I was going to go in and explain my situation, and she was going to say, well, Brent, you know, we can do the test, but you are negative and you know it. And I'd be like, not half as negative as you, girlfriend. And we would just banter back and forth like that for like 25 minutes. Her first question was, Brent, what are you going to do if you're positive? And the tears start to flow, Becky. Does that answer your question? You're a shitty therapist. You're bad at what you do. It was her way of bringing up medications and what happens when you do actually have HIV, which is important. The stigma of HIV no longer fits the reality, which is you can live a very normal and functioning life if you take medications. In fact, specifically in New York, they're paid for by the city if you don't have insurance. So these are all great things, and she's explaining all this to me. But as she's explaining it, she says, just so you know, don't get too comfortable. Because the most common side effect for the most commonly used medication for HIV causes chronic acne. Fucking Jesus Christ, Becky. How the hell am I supposed to get laid with AIDS and acne?